Hi, welcome back again. I'm Dr. Mark Wheaton. I'm owner, physician of the Lakeside Sports and Pain Clinic. We're located in Excelsior, Minnesota, and also right here in location in Monaga, Minnesota. And I'd like today to talk about a condition that you're all familiar with, and that is a pinched nerve. It's a very common diagnosis, and oftentimes a person will come in saying, Dr. Wheaton, I have a pinched nerve in my neck or my back or elsewhere in the arm or leg. So what I'm going to do today is, rather than discuss all the different locations for pinched nerves, I'm going to focus especially on the pinched nerves that are found in the lower back, because they are the most common, with a close second being pinched nerves in the neck. And in just a minute I'll show you a diagram of what a pinched nerve looks like. So a pinched nerve is just a general term for any time a nerve that comes out of the spine is exiting the spinal column and is starting to head down the leg. Oftentimes when a patient complains of pain, it may not be even located, the pain might not even be located in the lower back. It may in fact be located down the leg. And the reason for that is because the pinched nerve, which often occurs because of a disc herniation, and I'll show you what that is in just a minute, causes the pain to be referred or radiated into the leg or foot. So one of the early clues that a patient would have a pinched nerve into their leg or foot is by simply doing a test, which I will show on a subject here in a minute. So how this happens is that a person might be lifting a heavy object or even just twisting in a peculiar direction, something they may have done many times over and over. But a person will feel a sharp pain often in their back, but what's distinctive about a pinched nerve is that it will radiate the pain down the leg, usually one leg, not in the other, and the person will have this radiating pain that feels like a knife or a sharp pain. So I'm going to show the pictures to you about what a pinched nerve is, where it's located in the lumbar spine, and show you how that can impact the pain that they have down their leg. Okay, so here in this diagram we see a picture of a person's low back or their spine, and as we get this enlargement here we can see that there is a pinched nerve. That this is yellow cord-like structure is a nerve, and this goes down and it becomes the sciatic nerve right here. So we see that there's a herniated disc, and that's just a term for this little pad that fits between each of the vertebrae or the bones. And when that ruptures, it puts pressure on this nerve because there's only so much space for that to go. And the pressure there sometimes can be felt right in the lower back, but more often than not, this pain goes all the way down the leg. Now let's take a look at a cross-sectional cut of the same problem. So here we have a normal disc, and inside the disc is a softer material called the nucleus pulposus, and it's surrounded by a hard outer shell. But nearby is a nerve root, and this is one of the nerves that would transverse or go down to the leg, as we saw in the other diagram. So this is a picture of a herniated disc, and the internal material, the nucleus pulposus, it herniates out through a fissure in the disc, and it puts pressure on that nerve, and that's what we call a pinched nerve. In this diagram, the discs are right here, but I'd like to draw your attention to the connective tissue or the ligaments that hold the vertebrae together. So as you see, there's a network of fine fibrous tissue, and you see a long ligament here and all these ligament structures, and these are tight bands, and they are vital to holding the discs in place and to keep them from rupturing. So they are important, often overlooked reasons for herniated discs. Okay, what I'm going to do with this subject is test her using the straight leg raise. So if this was the affected leg, by raising it up like this, it puts neural tension that pulls all the way back into the spine. And if she's got pain that comes from a herniated disc, this will produce a lot of pain, whereas on the other side it will be normal. Then the other thing I'll do is I'll test the reflexes, both the patellar reflex and the Achilles reflex, and if those reflexes are abnormal, that further indicates what nerve level or nerve root is being affected in the low back. So now the patient is prone, which is meaning they're face down, and as we look down here, I am pressing on her vertebral levels, which many physicians don't do, and I find it very valuable to find out which levels are injured or weak in the connective tissue which supports the vertebral structures. So I'd like to conclude that portion of the examination then by telling the patient to stand up and then go through some other maneuvers and tests. But those are some basic tests that I do for a pinched nerve. So the treatment method I use more often than not is to do prolotherapy, an injection method that is natural to help to strengthen those weak ligaments and correct the herniated disc. It allows it to heal, and the person in a few treatments will be back to normal. So this concludes our discussion of a herniated disc in the low back and the sciatic nerve pain that it produces treated by prolotherapy. If you have any questions, don't hesitate to call my office at Lakeside Sports and Pain Clinic at 952-593-0500 or just visit me on my website at drmarkwheaton.com. We'll see you next time.